On October 24th, the National Convention of the AFL-CIO committed by resolution to take the lead in making healthcare for all a basic right and to support single-payer Medicare for all legislation. This didn't just happen. The resolution was submitted by 12 national unions, 4 state labor federations, and 3 central labor councils. With coordinating support from the Labor Campaign for Single Payer, they and others led the campaign over the last 8 years for a broader labor movement to take leadership in the healthcare for all fight. The delegates who rose to speak during the floor debate made a powerful case for why we need to take healthcare off the bargaining table by making it a right for everyone in America. Keep watching for highlights from these testimonials. The resolution passed unanimously. But this is just a start. With a tiny budget, the Labor Campaign and its member unions have worked tirelessly to bring the resources and organizing capacity of a united labor movement to bear on the fight to win healthcare for all. Now it's time to make it a reality.
My name is Sandra Falmel. I'm a registered nurse and a vice president of National Nurses United, and I am a neonatal intensive care nurse in Washington, D.C. The parents said, "What did we do wrong?" We did everything. We paid our insurance premiums, and this is not how this should have turned out. But as nurses, we see this every day. Every day of our lives, we have to watch working families who have insurance but can't afford the aftercare, cannot afford the medications. My son lives in Budapest, Hungary, and pays no insurance, has wonderful care, and this is a little poor country. Why can't the United States do this? And they can't because of profit, and more profit. I stand in full support of this bill and beg of you to vote aye.
Thank you, sister.
I believe it's about time we recognize healthcare as a human right. Most of us will recognize that we cannot continue to bargain our way out of the ever-increasing healthcare costs without giving up future raises. Brothers and sisters, let's pass this resolution and show the world that we care, not just about our members, but about our communities. I support this resolution, and I ask you for your support. Thank you, brothers and sisters.
I am proud to stand before you to support this resolution. Both my union and the Coalition of Labor Union Women have passed a resolution at their convention. I've heard a lot of quotes yesterday and in reference to the great Martin Luther King. But the quote I like is, "Of all the form of inequality, injustice in healthcare is the most shocking and inhumane."
ATU locals all over the country are locked in a struggle over healthcare costs. It is the one issue that unites us. ATU is convinced that a single-payer system is key to more successful collective bargaining. It would take the most controversial issue, healthcare, off the table, allowing us to focus solely on wages and working conditions. It would remove a giant sledgehammer that management holds over all of our heads. The Medicare for All bill is the main reason why ATU backed Senator Sanders in 2016, and we were proud to do so. Now, given the chance to support Medicare for All, ATU is all in.
Working families continue to pay more for health care and get less. We give up most pay raises to pay for the greed of the insurance industry. Our union employers continue to pay more and get less, and cannot compete with those non-union employers who pay next to nothing. Time and again, we've seen organizing drives stymied and stopped because of the cost of health care.
To be without health insurance is terrifying. As we heard from the stories this morning, many of our union members have similar stories. Let's pass this resolution and be on the side of all working people, the right side of history, and the side of health care justice for all.
Like every union in this hall, my union and all of its locals face the same nightmarish maze when it comes to health care. It starts at the negotiating table, where our bargaining committees are forced to fight like dogs to try to maintain whatever health care plan they've got. They have to sacrifice what might be better agreements on wages, on pensions, on other benefits. This is lunacy, brothers and sisters. This is what we're faced with. The only people in the United States who can get out of this are the senior citizens of this country who are entitled to Medicare. So it makes nothing but sense to me to say Medicare should be available to all. Medicare for every man, woman, and child in this country. This is the only responsible plan.
We stand with our brothers and sisters throughout the labor movement in support of this resolution, one that demands health care as a human right, not a privilege, through an improved Medicare for all. We have spent decades fighting for health benefits, with 82% of strikes occurring over health care, as our employers can constantly seek to shift the costs of benefits onto our members and onto other workers. Enough is enough.
Vermont is proud of its congressional delegation. They all understand that social justice and economic justice walk hand in hand. Bernie has stumped Vermont day in and day out for decades, preaching Medicare for all. Medicare for all would take health care out of negotiations. The U.S. is the richest nation on earth, and it's unconscionable, to borrow a term from Bernie, that the U.S. remains the only industrialized country in the world not to guarantee health care as a human right.
The American labor movement has fought for more than a century to make quality health care a basic right in the United States. We are committed to moving expeditiously toward a Medicare for all single-payer system. This resolution also commits the AFL-CIO to work with the co-sponsors of single-payer plans to ensure that they meet the needs and concerns of working people and their unions.
I am a nurse who takes care of children with cancer, and I witness these stories daily on the job of a failed private health insurance system. We must guarantee health care as a human right. NNU is organizing across the country, in California with SB 562 and nationally with S 1804, introduced by Senator Sanders and co-sponsored by 16 other senators. Both bills are consistent with this resolution. So join us, get active, and vote yes, make health care a human right. Thank you.